We want to welcome you all to the Institute for Perinatal Quality Improvements, Perinatal Quality Improvement Champions webinar. And we're very thrilled to have Miranda Klassen and Nicole Purnell as our guest speakers today. My name is Deborah Bingham. I am the Executive Director of the Institute for Perinatal Quality Improvement, also the founder of this organization. I'm going to just give a little bit of brief updates on what's happening at PQI, and then I'll turn it over to our amazing speakers today. So just to remind you all, the mission of the Institute for Perinatal Quality Improvement is to expand the use of improvement science to eliminate perinatal morbidity and mortality and end perinatal, racial, and ethnic disparities. All of our choices are made towards meeting that mission. And we're just thrilled to have all of you as partners in that work. We're very grateful for our Executive Advisory Board, which Miranda Klassen is a member of that advisory board, as well as our editorial advisory board. So now just let me give you a brief update from PQI, and just to remind you why we were formed is because of the high rates and the crisis of maternal mortality in the United States. That really definitely we want to really bring these rates back in line. Other countries have seen a decrease at the same time that the US has seen an increase. Also, we have huge disparities in these outcomes with pregnancy-related mortality ratios by race, ethnicity. Non-Hispanic Black women are 3 to 4 times more likely to have a pregnancy-related death than a non-Hispanic white women, and that's completely unacceptable, as you all know. And then also the non-Hispanic American, Indian, and Alaska Native women are also very high, also have an increased burden and disparity there. At the same time, our morbidity, severe maternal morbidity rates are too high. And I would say we also just want everyone to have better births, like dignified births and optimal births. And so it's not only about reducing injury and death, those are pretty low bar for what we are wanting to have, like very wonderful and optimal birth experiences across the country. And towards meeting our mission, we have created what's called the Speak Up Against Racism Action Pathway. We know that conversation is where change begins, and each one of us has the power to change the conversation. Speak Up is both an acronym and a mnemonic, and it's action-oriented, and it's based on, the whole program is based on quality improvement principles. I'm very thrilled that Renee Byfield, a colleague of mine for many years, is the program director for this Speak Up program, and she's just so thrilled that we were able to have her join our team this last year, and she's made a huge difference in that regard. And just to point out that Speak Up is a journey, not a sprint. Learning how to speak up, learning how to and dismantling racism is a journey, not a sprint. So we have a full action pathway for the Speak Up program, and you can learn more about this on our website. But the first step is we want every perinatal clinician to become a Speak Up champion, and those are steps 1, 2, and 3. We have quite a list of things that we think will help give somebody a strong foundation towards dismantling racism in our country, and then become then those that choose to go on to become an ambassador or other faculty member. And here's where it is on our website. You can find the whole program and tools there, a lot of free information, including a 28-day challenge that is available for people to join and be able to learn and grow, reflect, and has action items as well. We also have modules, so self-paced modules. These are 3 modules, each about 30 minutes to get through, 30 to 45 minutes. All 3 of them have CNE and CME. We also on December 2nd are offering our second ambassador course. Again, if you would like to become a faculty person for Speak Up program, you first need to finish the champions work, the Speak Up champion work, and then you can apply, then you can attend the ambassador course. Those who have completed both champion and ambassador course are then eligible to apply to become faculty, and we'll be releasing the faculty course in 2022. We have PQI profiles. We profile different people in the country who are doing cool QI things. These just inspire us all and help us know that work is possible. This work is possible. This is work. This is a profile of Deborah Bingham. We have several profiles, so feel free to check out all the profiles. And we're also working to reduce overuse of C-sections. We know that's a driver of severe maternal morbidity. And we want to support freedom of movement, support vaginal births, and again, reduce overuse of cesarean births. With that, we have launched some education around intermittent auscultation and are launching initiatives to supporting initiatives and launching initiatives to improve the use of intermittent auscultation. And we do have the simulation-based education. If you haven't checked it out, I think people who have checked it out have found it extremely helpful. It has 5 simulation based educational where you actually practice. So we first teach you how to do intermittent auscultation, and then there's some practice scenarios. And so just with no further ado, I'm going to just end by just saying we know that quality improvement saves lives. If you have questions or suggestions for us, feel free to email us at info@perinatalqi. And I am now going to introduce our panelists, very esteemed panelists, and so thrilled to have them here with us. I'll start with Miranda Klassen. She and I have known each other for a number of years. And again, I'm so thrilled that she is a member of our executive advisory board and has helped from the beginning of launching Institute for Perinatal Quality Improvement. And she's also, more importantly, she's the executive director of the Amniotic Fluid Embolism Foundation, which is a nonprofit advocacy and research organization. And she founded this organization in 2008 after surviving an AFE during the birth of her son. And so if you don't know about her organization, I strongly recommend you get familiar with that, her organization, and their full bio is on our website where you registered. And then we're so thrilled to have Nicole Purnell. She's a maternal health advocate. She's based in North Texas. And her life was tragically changed in 2005 when preeclampsia helped cause multiple organ failure. She had a placenta abruption and resulted in the stillbirth of her son at 34 weeks gestation. And she helped found the Preeclampsia Foundation and also is helping form the Mama's Voices. She's joined the staff as the Mama's Voices Coalition Program Manager. So both Miranda and her work very closely together on this new organization, which is a coalition of different advocacy organizations called Mama's Voices. So we're just so happy to have them here with us today. I'll turn the time over to them.
Thank you so much. I'm going to go ahead and share screen.
Perfect.
Thank you everyone who's joining us. And if you can in the chat, let us know where you are from. We'd love to see. We're trying to see if we can get someone from each and every state. All right. Deb, can you see these slides?
I do. It looks great, Miranda.
Fantastic. All right, so let's go ahead and get started here. Both Nicole and I have no disclosures. As Deb shared, we both work for individual organizations, and we are thrilled to be here with all of you this afternoon. Our hope today is that obviously all of you are interested in quality improvement, so thank you for taking time out of your very busy days to join us. We hope that through this, you'll actually get to see the value that patients, family, and organizations like the Preeclampsia Foundation and AFE Foundation and many of those that are comprised of Mama's Voices, how we can partner together, and various ways that you can include us in your QI activities that you're doing either at your organizations or within your state. So let me just give a brief background about how Mama's Voices was founded. Eleni Sigas is the executive director at the Preeclampsia Foundation, and her and I met back in 2008 when I started the AFE Foundation. We actually met through an NIH connection with Dr. Roberto Romero, who said, the two of you need to know each other. We were both really trying to find purpose in our lived experiences, and we're part of these organizations or had founded these organizations. And over the years, she became a mentor, and we found ourselves sitting in chairs next to each other at various organizations. We both sat on the Council for Patient Safety. We were both involved in whether our state MMRCs or our state PQCs. And we would often find ourselves at events, at A1 meetings or SMFM meetings. And we finally realized, we aren't the voice of all the patients, and we don't represent all the experiences, the broad experiences of women and families who've been impacted by severe maternal events or pregnancy and birth complications. And so we started talking about, we had so many cross-cutting issues. We needed training. We had a lot of people that were trying to volunteer for our organization. And we just felt like, how do we train these individuals and families to go out and speak on behalf of our organizations or speak on behalf of their lived experiences? And so we sort of put our heads together, and Eleni, being the type of person she is, she took it from an idea and put it into a full-blown program. And so several years ago, Mama's Voices was founded really as a part of the MERT for Mothers. They had a 10-year initiative, a worldwide initiative, to assure that no woman dies during giving birth. And through that funding, we were able to, with that seed money, create Mama's Voices. And what you'll see here is it's comprised of all the leading organizations surrounding the top causes for maternal morbidity and mortality. They range from 2020 Mom, which is maternal mental health, as well as Shaded Blue Project, which is maternal mental health for women of color, to ACRETA, preeclampsia, amniotic fluid embolism, sepsis, you name it, there is usually a cause for it. And so through that and through other initiatives and funding through AIM and Premier, we were able to actually get a full-time program manager. So Nicole will be joining me. And through this effort, we hope to show you in the next few slides everything that we have accomplished collectively. And I think that was the goal, Nicole, that we put forth, was how do we coalesce the energies of all these incredible advocates that are trying to find purpose through their lived experience? How do we coalesce these energies? How do we work together? And I am so proud to see what you have sort of forged ahead and led us through over the last 3 years. So Nicole, I'm going to turn this over to you to just share a little bit about the purpose and vision, and a little bit more about the activities that we're doing.
Thank you, Miranda. So like Miranda said, we got started just over 3 years ago, and it's been an amazing 3 years, and so much has changed and evolved since we began and what we where we started at. So right now where we're at is the purpose of Mama's Voices is really to amplify the patient and family voices, especially those who've been historically marginalized, ensuring they're equipped and activated to be partners to improve maternal health outcomes. We really have focused on this partnership aspect, and we're going to really dive into that today and some of those opportunities that we've participated in and how we can see this going forward for true partnership so that it's patients and providers working together to make that improvement. We really want to make sure that our vision is, sorry, it's okay, Miranda, that Mama's Voices are engaged as partners wherever maternal health improvements are needed. So whatever table, any decision that's being made, that there is a voice that represents the patients there at that table. What we do, we train and certify patient family partners. Some people call them patient family advocates or lived experience consultants or subject matter experts, but we call them patient family partners because we really want to focus on that partnership. So we just want to reinforce that. And I know that terminology has resonated with many people as well. We cultivate relationships with major societies and stakeholders. We're going to show you how that's come to fruition. We identify and negotiate opportunities for patient representation. How can the patient be involved in this maybe even lead it, the opportunity. So some different project ideas that are out there and that maybe aren't something that has been thought of before by your facility, but we hope to inspire with some different ideas today. We foster meaningful collaboration by matching trained patients with research opportunities, with media opportunities and other speaking engagements, and with quality improvement projects.
Thanks, Nicole. So as we'd shared, one of the first things that we tried to accomplish when we decided to form Mama's Voices was very quickly. In fact, Nicole, I think only had a month from the time we got funded to the time you had to put this event together, called Champions for Change Summit. And what it was a way to gather those who had expressed interest in wanting to participate in QI or research or participate in maternal health improvement, and yet didn't either have a home, they didn't have a home organization, or they were associated with an organization, but that organization, including like the AFE Foundation, didn't have the resources to put together an opportunity to gather in one setting. And so Champions for Change Summit was sort of born. We've had 4 summits now, and they have been just powerful, incredible events. And over the years, we've actually brought in providers as well, healthcare providers that have participated and come to see this experience and sort of immerse themselves in the patient experience. And so if I can just share, we've had, again, 4 summits over the last 4 years. The last 2 have been a hybrid between virtual and in person because of COVID. But in our first 2 years, very, very powerful. I've had the opportunity to attend all of them, and I will say that they were transformative, they were inspiring, they were emotionally exhausting. But it was not only a time to sort of join in this sort of sisterhood, if you will, but also a time to hear from speakers from all over the country come and share everything about where we are in the maternal health space. You know, many of us were just patients. We don't speak the language. We don't understand the acronyms. We don't understand the historical context to maternal health and how we've gotten to the place of where we have this, increasing maternal mortality and morbidity. And so through Summit, it was an opportunity for us to connect with one another, but also hear from these powerful speakers, legislators, policymakers on how we got to where we are and how we could be effective in not only sharing our stories, but actually partnering with institutions and organizations and improvement projects. Overall, we've had more than 500 patient family partners come through our training. We've had, oh my gosh, I think, Nicole, maybe 45, 50 speakers come through. We've had opportunities to showcase the individual organizations that comprise of Mama's Voices. And I think one of the most powerful things I remember, Nicole, seeing was having Barbara O'Brien, one of our champions from Oklahoma, come. And I remember seeing her just with tears in her eyes and seeing the power of people sharing their stories and realizing just how much energy we had and how much we want to participate and partner with everyone. And I know that, she's shared with us many times how moving that event was and how inspiring it was for her to go back and really be a true champion. And so I know you'll get into it here later. Nicole will share how those of you who are joining us today can also participate in whether it's a Champions for Change or participate in some of our events. Nicole, do you want to talk about the training and certification that these champions go through, not only at Champions for Change, but now for those who can't come and gather, what we've done through the website and through our training platform?
Yes. So one of the benefits of things we've learned and adapted through COVID is that we don't have to do everything the same way we used to, which has been wonderful. So we have actually taken some of the pieces that we had in our Champions for Change Summit, which started off predominantly as a training weekend. And it's a lot. Those of you that have been to conferences, like just swallow that much information in a weekend and you leave and you don't even know what day of the week it is. So taking that opportunity and breaking down the information into bite-sized modules that people can do at their own pace has been something that we launched this past year in May. And this is a program that we're very proud of. It starts off with advocate readiness. And that's a piece that I'm very proud that we put together. I haven't seen anybody else offer anything like this across any other service lines or conditions that help work with patient advocates. And knowing that a lot of this work comes from a place of trauma and it's very emotional. And so making sure that advocates have had a chance to process that and that they have tools in place, that they know that there's resources that are out there. They know how to get to those resources if they need them, so that they're prepared through their healing journey before they start this work, while they're doing this work, and then after doing the work, because we know a lot of times it can be a really heavy toll sometimes to do this work. So we want to make sure that they have that in place. Then we talk about sharing their story, how to do it for different audiences, do it short, do it quick, do it long. We really want to make sure that they have a good grasp on doing that, because that's such a powerful part of this piece, is bringing the face to the data. We also talk with them about creating a professional presence. So this was a new piece we added as well. It came out of some of our summit training, was starting with, how to be yourself, how to position yourself with media, social media, traditional media, also how to create an advocate CV. There's so many times you get asked for a CV from somebody, and if you're just an advocate, you might feel like you're not adequate or ready for that role. But when you start to put together some of the things that you've been involved in, and having that prepared before an opportunity comes to you is really important. So we make sure that they have these things ready, and headshots as well. We also do touch base a little bit on quality improvement in our certification program, but we will be focusing a lot more on that through our continuing education pieces, which will be rolling out here before the end of the year. We'll have modules that talk about perinatal quality collaboratives, maternal mortality review committees. We're going to go through all the AIM patient safety bundles and break those down into, really common language, so that patients understand what their role is, what they should be looking for. If they're in a PQC and they're listening to the terminology in the meetings, that they will have some foundation and understanding and not feel lost in those meetings. And we'll also be talking about research. So this program is really, it's been beautiful to see come to fruition, and I feel like it's very powerful. And now that we have some legs underneath it, we're collecting data on it. And it's a product that's going to be able to measure what that is like for patients, and making sure that those engagements are meaningful for them and meaningful for providers, and that this partnership that we really want to focus and build on works. So we're excited about this. We've had some states that have been involved in it as well. So I think that will be good for the next slide. There we go. So one of the things that we do is we want to think about, like, why do patients and families want to get involved in this work? And it's not the traditional, or the thought is not, don't be scared about, like, if we invite patients into this meeting or invite them to this committee and this leadership and this table, that they're going to come and it's going to be the complaint session, it's going to be pitchforks and torches, because it's not like that. Most of the people that we work with, they're really coming at this from an altruistic standpoint, and they want to help others. They want to make sure that someone else doesn't go through what they went through, and maybe they can speak up and use their experience to help somebody else. They want to be a voice for those that don't have a voice. Maybe those people are, they didn't make it through this journey, or they're just so traumatized that they can't use their own experience. So they want to be that voice for those that can't. Sometimes it's a way to remember loved ones. I was reminded of this week, that, you've been doing this work for so long, and I've always talked to people about building a legacy for your family member, your loved one, your child that's been lost, whatever that looks like, but find a way to build a legacy and carry them on through you. And part of this, it feels like, is you continue that on, because if you don't continue to do this work and find meaning to that loss, then what happened with that loss? We don't want it to be just a life that was lost for no reason. And then oftentimes it's finding purpose from a difficult situation. So we promote that quite a bit, being able to find that so that you can use that later on. And one thing I wanted to ask everybody on this call is, what inspired you to do this work, to get involved in quality improvement? Right now, there's a lot of fatigue, there's a lot of shortages, and we hear about it all the time, and we feel it. And maybe going back and thinking of what that memory is. Maybe it was a patient that you worked on, maybe it was your own experience, but what was it that inspired you to do this work? And think about that, especially when the fatigue sets in, and when you're really tired, or if you're just looking at data and you don't have that face to put with it and that reason to keep going. Just think about what that is and remember that.
Nicole, in fact, I would love to ask everyone, if you want to put in the chat, is what inspired you to go into QI? There's so many aspects of being in healthcare, and I always see people that are in quality improvement and just think they are such champions for true patient-centered care, because it's a step beyond. It's not just caring for the patient. It's a focus that they have that goes above and beyond. And often you're not paid extra for this work. You're not recognized for this work. And sometimes you always don't necessarily get to see the true fruit of your labor, if you will, especially if it's a program that takes some time to either capture data, and sometimes it's quality, right? And so we don't necessarily always get quantity. Qualitative work sometimes is really just more about how people feel, and people feel supported. So I'd love to hear in the chat if you're willing to share. We'd love to hear what inspired you to get into quality improvement. That will certainly help inform what we do at Mama's Voices going forward, because we want to hear directly from you. Nicole, do you want to cover a little bit about what we can bring to the table? I mean, I know we've talked about just sort of telling our stories effectively, but it goes so much more beyond storytelling. And I love that, you know, one of our colleagues and one of our champions, Christy Allen at AIM, has really underscored this, is we are not here to exploit people simply for their stories. We know that storytelling is powerful, and storytelling is what brings the emotion to the work. But aside from telling personal stories, what else can patients get involved in? What else do we bring to the table?
Yes, so oftentimes we talk about getting past just the story and hearing patients, but then how else can you involve them in your work? And some things that can be done are, besides that, are identifying pieces of the process that might be confusing. So looking at from the patient perspective, I know Sarah Johnson's on this call from Oklahoma, and her and Barbara O'Brien are great about talking about creating a culture of acceptance and what that's like for patients. So if you have a patient that's coming in, they're sharing their story to you, and there might be pieces that are absolutely not clinically sound. And that's okay, because what they're doing is they're identifying the gaps in the process. They're identifying gaps in their understanding. And so we can learn from that and hear what they're saying and how we can make it better going forward. They can participate in information and data gathering. Miranda earlier was like, I have never done that. I'm like, the heck you haven't. You do too. You work with research, you've sat on MMRCs. That is part of looking at the data and how that's looked at, and translating that and seeing where those gaps are as well, and what that looks like from your perspective of not maybe having the same clinical or research background. Can discuss and analyze findings. Same thing. Recently I was on a project with Deb for the NQF, and I did not know what I was getting myself into when we started that project, but boy, did I learn a lot. And being able to be a part of those conversations, even if you don't have that specialty expertise in it, being able to invite patients to that is beneficial for everybody involved. Can help in developing action plans and recommendations. It could be as simple as walking the parking lot, from the parking lot into the NICU, and making sure that the signage is clear and there's no confusion on how to get to the NICU, because you have family members coming and different things, or maybe they even got transported. You're expecting transports that come in and they didn't get that same package that people got when they were registering for the delivery. So just things like that that you can have patients involved in as well. Contributing to the design and content of materials, making sure that they're in patient-centered language, and they're not in clinical language, and they can be easily understood. Providing objective feedback about the patient family perspective. There might be times where that perspective and what happens is lost. It's lost in the chart, it's lost in the data, but you can have a patient that can come and maybe that's their own case and they're able to provide feedback on a debrief, or it's somebody else that's in the process and they're able to say, maybe this happened, and able just to provide that face to the story and bring some humanity to it. Can assist with piloting and testing new materials and processes and following up with other patients and families to gather opinions. This has been a great program actually out of Oklahoma. They've been gathering materials, making their own materials, and this has really been led by the patients that are working on their team and the network that they've been building there. So it's been beautiful to see. And all of these are recommendations. We just have the source cited there. So when you get the slides, you can check that out for more information.
Thank you, Nicole. That was fantastic. This is sort of like a word cloud, if you will, of all the different ways that we can work together. And I would love to hear in the chat again, too, if when you look here at these words and what Nicole just shared, are there ways that you've already worked with patients? Have you worked with patients before in any of these activities, whether it's creating focus groups or a patient advisory council? Maybe you had a patient that you helped treat or care for, and their experience led them to want to give back, and so that you were able to put them on a focus group or an advisory council. Have you had any ambassadors for your work or for your organizations? Have you ever participated with patient-led research? I know just for me personally, just, it's something that I do on a regular basis is work with institutions for our AFE registry. So I'm oftentimes working with labor and delivery clinicians or healthcare providers when there's a case of AFE. So have you ever helped submit a case to any of the patient-led research opportunities that are available, which we're going to get into in just a bit? Have you had patients participate in grand rounds through sharing their stories or providing feedback? And I can't wait to talk about this in a couple slides, just about the power of including patients in simulation, which is certainly something that has likely not ever happened in your facility. If it has, we'd love to hear about it. And I guess my other question too is, for those that are on the call, is how familiar are you with the various patient advocacy organizations? I shared a little bit of the list here earlier with that comprise of Mama's Voices, but are you aware that there might be an organization or support group for something that maybe one of your patients is going through? Nicole, if we could, what I would love to do going forward is just sort of share, because I think it's sort of an inspiration of all the ways that we've worked with the various key stakeholders in maternal health. When Nicole and I were putting these slides together, I kept telling her, this is like the most incredible brag book, if you will, of all the work that these patients have done. And collectively, I think we've all known about it. Here at Mama's Voices, we celebrate these wins and we celebrate these opportunities with one another. But to be able to have this opportunity and platform, so thank you, Deb, to have this platform to be able to share that work it's really inspiring. I hope that those that are attending are inspired by all the work that we've done going forward and how much excitement, enthusiasm we have to keep moving forward.
Yes, so we were so excited when the Hear Her campaign started for just many different reasons. And I know Miranda's part of this project as well, because all of Hear Her goes back to the council's urgent maternal warning signs. And that was a long project that they lifted over there. We were able to provide patients that were in these videos. We were able to provide patients for focus groups because they went through a focus group process. For these, we had sneak peeks before they even launched the campaign for our feedback as well. So we're really partners in the Hear Her campaign, and just thrilled to see the excitement and the way it turned out. And then we were able to have Dr. Barfield come and join us at Summit, our virtual Summit in 2020. And she was just fantastic. She's so down to earth and really shared with us, what the status is across the country and why they are so passionate about this campaign at the CDC as well. So we enjoyed having her, and we stay connected with the CDC through their MMRCs and the NNPQC as well.
Similarly with SMFM, we also have had these incredible keynote speakers. Dr. Lewis, who is the immediate past president of SMFM, was just our keynote speaker at this last Champions for Change Summit just a few weeks ago. And as a patient in this space, I have to say how appreciative I am for the opportunities when these individuals take time out of their incredibly busy schedules to come in and interact and help educate and help speak at our organizational meetings and our training. It's so validating that they truly are very focused on patient-centered care and really do care about the patient. I think it's probably belabored, but just people that are in QI work, I feel really truly do value the patient experience and the patient care, and that's seen through their actions and how they spend their time, and including Dr. Lewis, who, Champions for Change is on a weekend. And so all of these speakers that have come and presented come in on, they're not, many times they're not being paid, or they, give their honorariums back to our organizations. And so it's just so powerful. And Dr. Barfield was amazing as well. We've had some really great success in forging relationships with the societies, like the Society for Maternal Fetal Medicine. And we've often said that, if we can continue to do this work, we can replicate it with all the other societies, whether it's, ACOG and AWAN and ACOOG and all the midwifery organizations, because it really is a template for going forward about how you can engage patients. Back in 2019, a group of us were able to gather in DC. Our organizations paid for representatives to go out and meet with the leadership at SMFM and identify ways that, what did they need from patients? What did they need to hear from patients? Was it focus groups? Was it feedback? Was there opportunities within, one of the things I've always pitched is, on their podcasts, on the green and gray journals, have a patient corner, have a patient perspective corner. Data is important, but, putting the stories together, and Nicole, as you shared, sharing perspectives that really aren't found in the data. How can we elevate those patient stories, and what programs were they working on? They asked us, and they worked with Nicole on creating an advisory committee for their high risk website before it launched, to make sure that it was appropriate, to make sure if it's patient facing, do we understand what it's saying? Is it frightening? Is it helpful? How do we access this information? I was given a tremendous opportunity to speak at SMFM at their annual meeting for the state liaison network, showcasing what Mama's Voices does, much like we're doing today. And I think, this was sort of always the giggle that I have is, when Eleni and I were starting this work, we would always say, when we would go to these society meetings, we were sort of a table off in the corner, and it was a considerable, financial cost for us to be an exhibitor at these large society meetings. We're not selling anything, and we're sort of the table. We always have Kleenex at our table, because as healthcare providers come through and see us, they want to share their stories of how they've been impacted by hypertension, or an Accreta patient that they lost, or catastrophically in AAFE. And so being an exhibitor at these booths where we're able to meet individuals in this space, hear their stories, sort of wipe their tears too. I always would tease that we were sort of like the table of gloom and doom, where they'd come and share their sad stories. But ultimately, what we found was it was incredibly impactful, that people didn't realize that there were so many organizations out there, and there was a place for them to send their patients. I think so often when unexpected and bad things happen, and we sort of leave the space of the inpatient setting and we go to an outpatient setting, and I always say, we leave the loving arms of those that are caring for us in most circumstances, is where do we go from there? And I think there's a sense that healthcare providers are very attached to their patients. They want to hear how their patients are doing, and they sort of feel like, well, where am I going to send them now? They've been traumatized through this experience. And so having a booth at SMFM and showing that there were all these organizations that these providers could send their patients and feel confident that we were going to wrap their arms around them and sort of be that gap in the continuity of their care. And so this has really been shown to be very, very impactful. So if you are involved in putting together if you were on the planning committee for any of the annual meetings that you put together, we would love an opportunity to have a space and a table to come and showcase the patient education that we provide and the support that we provide to the providers that are in your specialty. Nicole, do you want to talk a little bit about Premier? That's been such a great collaboration as well.
And this is fairly new. So about 2 weeks ago, I presented with Deb and Dr. Fink. And so any day now, they should be releasing the final roster of hospitals that will be participating in the Premier Perinatal Improvement Collaborative. There's about 220 hospitals across the country that will be a part of this, and really getting into the data and finding out where those measurements are successful and where they need improvement. So we've been able to be a part of this, providing feedback on the metrics and making sure that, like, where are the questions and what did you consider this, and some other things that they've been able to incorporate as well into those metrics. They're in the different focus areas. We will be providing technical assistance to the hospitals that are part of this project. We'll be contributing to the collaborative's knowledge and joining their monthly calls. We'll even be the primary speaker on the call in January for this project. So we're also participating in the HHS Premier Maternal Infant Advisory Committee as a key stakeholder. So we're really excited to see where this project is going to go. We've got just getting started in 5 years to get it going, but it's going to be exciting, and the way we can bring a level of partnership with patients from all across the country, because there's a hospital represented in every single state.
Wow, that's fantastic. I know you've done a lot of work with AmChip as well.
Yes, and I was sitting here before this slide came up, like, man, there's a big fat error on this slide. Jonathan Webb is no longer at AmChip. He's now at A1.
But he was, but he was at AmChip, and you got to work with him at AmChip before he moved to A1.
Yes. So we're talking about AmChip. Our patient family partner training is part of the innovation hub that they have for different programs that affect maternal child health. And it has been just so helpful for us to be able to go back and look at things and make sure we're putting the processes and measurements in there, and knowing that we're continuing through their continuum as well. So we've been really excited about that. It's been so beneficial to us. If you're also, I know there's a couple other states and projects that are in there too. And then Jonathan Webb, who is the new CEO of A1, was a speaker at our summit just this past month, and his presentation was so powerful. I saw him at a PQC meeting, I think in Oklahoma, because they're just really down the road from me. And he was great. So we appreciated having him come and talk to us about the historical context of racism in the US.
And I would say, if you haven't seen his presentations before, wow, are they powerful. And he provided a monopoly analogy that, if you haven't seen it yet, it was incredible. I think that was the biggest feedback we got from all of those that attended Champions for Change. Can you talk a little bit about what you and Deb do at NQF?
Well, this is the roster or standing committee of the NQF project. We just wrapped up. It was a maternal morbidity and mortality work group, and I just put little arrows next to our names. I was, I think, only one of maybe two that didn't have any extra letters behind my name, and sometimes I felt it, but that was okay. I might have been asking questions to friends and colleagues and off channels, or even asking the NQF some questions as well, because we talk about risk. I think there was one question I asked them, they're like, we don't know how to break this down into common language. I'm like, what does risk adjusted mean? I need help understanding this. So asking some good questions and making sure that they're there and the understanding's there. This report was just released a couple weeks ago, and so that's the link to read it if you want to. It includes some practical recommendations for improving maternal health outcomes. So we're excited to see that done and come out. And it was 18 months of labor of love and lots of meetings and a lot of reading literature and data and discussion. So it was a fantastic project to work on.
Thank you. I know we've also done quite a bit of work with NICHD. I know me personally, as well as through Mama's Voices. We've had just an opportunity here. We're just showing the speakers that were part of an engagement forum on improving health. Jackie Wallace, who has been leading up a new work group looking at how to reducing disparities and improving health outcomes. So we've had opportunities to place speakers from Mama's Voices, both the opportunity to provide a platform for what other organizations are doing. And, I think I'm just coming back. I'm still coming back from a little bit of a high last week, returning back from Detroit, where I was out at the Perinatology Research Branch. And I put this picture in because, Nicole, one of the things that you said, one of the things we talk a lot about is, especially for grants or for committees, we're trying to hardwire patient engagement and patient family partnership in QI activities, but it's more than just checking a box, right? It's more than just having someone at the table. It's truly engaging them. And I just wanted an opportunity to share just how powerful partnership can be. I shared earlier that I was actually able to meet Eleni at the Preeclampsia Foundation through the opportunity of sort of introducing myself to Dr. Roberto Romero at the NIH and sharing, what the work we were going to do, and his saying, well, gosh, you really need to meet Eleni, and him taking the time to foster and develop an introduction, which turned into, a lifelong friendship and opportunities to be colleagues in this space. But recently, the AFE Foundation has engaged, we've had a longstanding relationship with Baylor College of Medicine, and have a biorepository at the NIH. And we are making some upcoming changes to that. And Dr. Ramiro said, you know, I really believe it's important that you come out and just come out to the NIH and just let's have a weekend together where we can talk about our partnership and what you need, Miranda. What does the AFE Foundation need to accomplish the research? I think that we can do a lot with specimens in a biorepository. And so I you know, in addition to feeling to not only them underwriting the cost of us coming out, we, Dr. Stafford in this picture here, who leads our registry, and I showed up to fanfare, if you will. There were signs. We were given white coats. I mean, she's a doctor, so she gets a white coat. I'm not going to ever have a white coat, but there was a white coat available for me as we toured the PRB. As we sat, we had, you know, we had an office available to us. We had 2 research fellows that were our scribes. It wasn't just a feeling of, hey, come out. It was truly one of the most powerful things I think I've ever experienced, of feeling validated and feeling like I was truly a partner. And I know that others in Mama's Voices have experienced the same partnership, but I really just wanted to showcase and thank the NIH for their continued partnership and truly valuing patient-led research. We would not be as successful as we've been or have the success going forward without their validation and their support. I know you, Nicole, one of your biggest pride and joys is the work with Dr. Ollier and the work at ACOG and all the work we're embarking on with AIM. So, and you know, I was going to say, Nicole, too, when we were putting these slides together, is going back to the AMCHIP, is a lot of the work that we're doing with AIM wouldn't be possible without having their buy-in from AMCHIP as well. And so it really just goes to show that having relationships with all these various stakeholders really is powerful and can move us forward for the work we're trying to do.
Yes, and I think Dr. Ollier is on this call, and really, I remember like stalking her down at a meeting in DC for the CMS Rural Obstetric Work Group, and I was like, we have to have you speaking at our event. And man, what a powerful story she had when she came and was a keynote for Summit in 2019, and just shared really why she's so passionate about maternal health and QI, and how her experiences as a clinician have shaped her into what she is. And it's really opened the door for us as well with ACOG and with the AIM program. And man, we are so thankful for them and having that belief that patients should absolutely be a part of the process, and they live it and breathe it there. We have been working with them on AIM bundle training for patient partners. So we're incorporating this into our patient family partner continuing education, where they funded us to break down all of the different bundles and have the experts come and explain it in a way that patients will understand what they're looking for and what that means. We've been working on a project, and we're in the midst of it right now, which is a huge project, and talk about patient-led research. We went to them and we said, you know, this support after severe maternal event bundles just really just not hitting it, and it needs some love. And I hear from providers that it's like one of the hardest things to implement. And so what can we do to make this better? And if we're talking about support after a severe maternal event for patients, it should be developed by patients. It should be led by patients. And they said, you know what, you're absolutely right. And we will find that funding to make it happen. So we're in the middle of this project right now, where we went to them. They are totally backing it up, this research project. And we are doing a needs assessment right now, a survey for patients to say what they experienced and what would have helped them more. So if you have any patients or networks that you can share that with, it's on our website at mamasvoices.org/survey, not just for patients, but also for families as well. So we want to make sure we have a very diverse representation in this, and it would really help if y'all can share that out as well. Because what we're going to do is we're going to take this feedback from the needs assessment, we're going to do focus groups on it and get more detail on what would have been helpful. And then we know we've all been there, like patients sometimes ask for things that might be over the moon, like I need 10 pillows in my room, and that might not just be feasible. So we want to make sure that these recommendations are feasible, and we'll be circling back with providers to making sure that this can actually be implemented, because we want a project that is successful, and it has to be a partnership in both ways. So Miranda's been on that work group, and I've been thrilled to work with her on that, and just really creating that space for the patients to have that voice and lead that has been amazing. So we hope to have this wrapped up this summer and have that feedback back to AIM so they can incorporate it into making a better bundle. One of the new projects that we're working on with them, and this is another place, if you're going to be interested in this, to make sure to sign up on our website to stay updated for news that's coming from it. But we will be supporting one of their communities of learning. So they're going to have 3 different communities of learning, and we will be hosting one of those, and it will be geared towards PQCs and helping them understand patient engagement and actually taking it from aspiration to actuality. So we will be very immersive with PQCs on this training, and it will be several cohorts. It'll be about 8 weeks of training, and then we'll have 90 days of follow-up, and we'll be doing data measurement and collection as well, because we know that's important into this process to show what you're doing and to be able to measure that as well and show those outcomes. So we're really excited about this. We'll be kicking off in January. So stay tuned. And if you are interested in it, you can go to mamasvoices.org. And then under the providers, there's a link for interest form, and put your information in there. I'll have it linked in here a little bit later on as well, to stay up to date on what we're doing for this and being able to offer that. One of the things that we'll also offer in this community learning is an opportunity to train your patients. So I saw in the chat, someone was like, how did you get funding to train your patients? It's going to be incorporated into this. So we're making sure that this project is really going to train providers on how to work with patients, and patients with how to work with providers, and we're going to do it real time.
And Miranda and Nicole, just a time check. We are 10 minutes to 1. So if we do want to have some time, there are some questions in the chat. So yeah.
Sounds good. Just as Nicole shared with the state PQCs, we do have a lot of opportunities. We have a lot of representation on the state PQCs, but if you are involved in your PQC or any of those projects that are coming out of there, whether they're bundles, is to identify whether it's out, implementing a toolkit or a bundle, or if you need patient representation, we would love to be able to match you. We do have 5 patients that have been trained through Mama's Voices sitting on MMRCs in the various states as well. And I know, Nicole, you've done a lot of work with NNPQC, but let's go ahead and get through some of these slides. If you want to share just how we've been able to identify and negotiate patient representation, and how those that are attending or listening in, how they can actually identify and negotiate for patient representation in the work they're doing.
Sure. So I've seen Sarah Johnson, who's in Oklahoma, been chatting about what they've been doing. So I'll let that to her, because she's been doing a good job over there explaining how they work. Texas A&M has been a very large project that we've been working on for several years in the making. And I say that patient engagement is a process. It's not an overnight thing. So it takes time, and it's gone from just being invited and having a chance to attend their annual summit to now that we are recruiting patients for hospital participation across the state. Where Eleni is sitting as faculty on the hypertension work group right now. There's been many different things, and we're really excited to work with them on that. And for them, they wanted to lead something. And so now CMQCC is like, we've led so much stuff. We're going to let Texas lead, and then we're going to follow in their footsteps. So Miranda sits on the executive board for the CMQCC, and they've had patients involved in those projects and work groups as well. I know for the hemorrhage bundle and hypertension bundle and maternal mental health bundles as well. CPCQC is Colorado's PQC. They recently got some funding, and they have provided Mama's Voices training for 10 of their patient advocates. And Iowa's Maternal Care Quality Collaborative, they have also provided funding for several of their patients over the past 2 years to attend our Champions for Change Summit.
Thank you. I think we had put this in together again a couple more times throughout the presentation, just asking people to chime in about where they might be able to see through some of these ideas of where they can engage patients to participate in their work. And again, this was the survey, Nicole, that you were sharing just about how we've put together this for the AIM bundle. But again, it's a great opportunity that if you are going to put together a survey or a questionnaire that's going to go out on a project that you're working on, run it by Mama's Voices, reach out to Nicole and see if there's a way. We're happy to test it. We'll send it out to our engaged advocates, which has got several hundred, if not close to 1,000 individuals that are engaged with us, that are active and ready to take surveys and give you that sort of feedback, if you will. Again, just making sure that if you are on this call, checking out mamasvoices.org/partner to see who's out there. I know that we have representation on the call today from several of these organizations. If you don't know us, please come to know us. We are here to partner with you and help your patients, especially when it comes to that support after a severe maternal event. We want to bridge that gap in their continuity of their care and in their healing process. I shared earlier about how excited I was about simulation. Many years ago, I had an opportunity to present my case through simulation, where it was obviously very early on after our personal event with AFE, but we had the opportunity to go in and share. And so I was the voice of the patient. My husband played the role of the spouse. We did the simulation. We didn't tell anybody in the audience that we were participants. They just assumed we were healthcare providers doing the simulation at an annual event. And then afterwards, we noticed that sort of people were checking their phones and not necessarily, it was another simulation they were sort of watching. And then afterwards, we were introduced and said, this is the actual patient story. And these are the actual patients and families that were impacted by this case. And sort of everybody kind of put their phones down, and they were very intrigued to think, wow, this was their real case. And then everybody had questions about how I was doing, or, how the staff was doing after an event like that. And so I shared this experience with Dr. Shad Deering, who's a Navy trained doc and an expert in team steps and an expert in simulation, and has done a lot of work for the Council for Patient Safety on using simulation. And he incorporated that idea and said, you know what, you're right. We need to make these real stories. We need to make a meaningful. Simulations are hard to do. But if you can simulate a real case and involve the patient, maybe the patient can give sort of their perspective of their case that's not in the data or in the records. It's really, really powerful. So I would encourage, if you guys are doing simulations at your institutions, to reach out. When patients understand that their case could lead to greater learning or greater opportunities, it's a very powerful experience. They, again, finding that purpose or knowing that learning can happen after an event. Nicole, I know that you're always excited about, we had this plan where everybody could, sort of pin on the map where they were located. But again, if you're new or you're just joining us, if you want to share where you are in the state, we'd love to partner with you in your state and your activities. Nicole, did you have anything you wanted to add about that?
No, that's all. I was going to say the simulation training that we did at Summit in 2019, when we set it up with Dr. Deering, who is a doll, was very much like, this could either be make or break. It's going to be hard for people, but I just highly encourage them to go to it. And I wish we'd had the advocate readiness prepared back then, but people walked away and said that was the most powerful session of that event that got to attend it. And yes, it was hard and heavy, but it made such a difference for them as well. So definitely consider bringing patients into your simulations.
I know, do you want to talk about bringing on a staff liaison? I think one of the hardest things that we as patients find is finding our, domino, or finding our Lego piece, right? In this work is we sort of need a champion. And I love the story of Barbara and Sarah in Oklahoma, and how it went from a patient reaching out to their state PQC saying, hey, I had an event. It wasn't fantastic. And Barbara receiving that news sort of very lovingly and looking through with empathy and gratitude that she reached out, and then it blossoming into this beautiful relationship, into where now Sarah is on staff at, in Oklahoma, and really, just like you said, really leading the charge between Oklahoma and Texas, leading the charge in patients being involved. Do you want to talk a little bit about what a staff liaison, how you could be a staff liaison, if you will, if you're a healthcare provider?
Yes. So we will be providing this training. Is going to be starting very soon. It's going to be part of it's going to be incorporated into the communities of learning as well. So if this is something that you'd be interested in for your PQC or for your facility, make sure to go to mamasvoices.org/interest and let us know so that we can keep you up to date as soon as this comes out and those opportunities present themselves. The communities learning will be a fantastic way to get in there. There will be an application process through the AIM program. But it's something that they will be taking care of the cost of it for it. So make sure to apply for that when those applications come out here in the next few weeks. We really are going to go through again, like what's patient family engagement 101, and then what it takes to be a staff liaison, because that's really a critical piece to this and what that looks like and how they can onboard and recruit and facilitate and build trust and do that knowledge training, knowledge translation. And like Sarah in Oklahoma has done and Barbara is create a culture of acceptance, which is really important.
Absolutely. And I'll leave it there. I think, hopefully everyone feels that we've given some good examples of how patients have been involved in the work projects, and sort of inspired you to engage patients. So Deb, we can open it up to questions. Here's our contact information. And of course, you can just always jump on to mamasvoices.org and you'll find real easy ways to connect with Nicole.
We are out of time, but I just feel like you've answered so many questions already. You were anticipating all the questions. So this was fantastic. I think you started out and we want to end with just reach out, right? Just reach out. And involve patient. And I love the fact that you actually help people be prepared to be in that advocate role. And being open to learning from our patients. So just applaud both of you. You're amazing. You're just amazing. And it's so exciting. All of those resources you shared with us and all of the information. And just thank you everyone who joined. We had people from 19 different states.
Ooh!
Yeah, I counted them up. And yeah, this is recorded session, which will be then shared on our website. And so you can share this recording. We'll be posting that probably within 24 hours. So thank you to everyone for being here today, in particular to Miranda and Nicole for all of your tireless work, all of the important work you do. And thank you for everyone who chatted in. It was a great discussions going on. So have a great rest of your day, everyone. And thanks again for everything.